Welcome all. Thank you again so much for joining us today for our monthly webinar. We have on the screen on the left-hand side some virtual meeting tips for today's program. We ask that you put your questions in the Q&A at the bottom of your Zoom screen, and then you can use the chat feature at the bottom of your Zoom screen for comments and conversation. But again, please put any questions you have about the program in the Q&A, and we will do our best to get to them at the end of today's program. And again, if you are having any technical issues, please let us know in the chat, and we will do our best to assist you. So on the right-hand side of the Zoom screen, you will see new at Nursing Home 411. So these are things that we have recently published. So the first one that you see is an oral history project that we put together. It is interviews with residents, family members, advocates, and others about their experiences throughout the COVID-19 pandemic. And just so you know, all these things Sarah has put a link to in the chat, so you can find them there. The second one is a Let's Win. So this is a success story about how your advocacy, it matters and it works to get wins for residents and loved ones. And it is also a request to support LTCCC in our continued work so that we can better help people like you joining us today to keep advocating, learning, and pushing for better care in nursing homes. We have new nursing home COVID vaccination and facility data up on our website, and a new alert about the Build Back Better bill and the essential staffing standards that we believe should be included. So there's information in there on what you can do, and that includes calling your senators and telling them why those provisions are so important to be put back in the bill. And then lastly is the latest Elder Justice newsletter. It's a no harm newsletter. And it's actually a really nice segue into today's program. So be sure to check all of that out at Nursing Home 411. And just before we really get started today, I just want to say a huge thank you to all of our supporters, all of you joining us today who have been supporting us over the years, or if you're new, we so appreciate it. We are able to do what we do because of you. And so we really thank you for that. And if I forget to mention it at the end of today's program, we wish you all a safe and healthy holiday season. So we are now going to get started with today's program. So we are the Long-Term Care Community Coalition. We are a nonprofit, nonpartisan organization dedicated to improving care and quality of life for the elderly and adult disabled in long-term care. We do that through policy research and analysis, systems advocacy, and public education. And we are lucky enough to be the home to two local long-term care ombudsman programs here in New York State. So today's webinar features LTCCC's Director of Policy and Communications, Eric Goldwine, and he will be discussing LTCCC's latest report. It's called Broken Promises, an Assessment of Nursing Home Oversight. And so this is really a part two of a two-part webinar series. And so before I turn it over to Eric, I'm just going to provide a little bit of background. And some of this is probably a bit repetitive for those of you who joined us on the November webinar. But as you can see previously on Nursing Home 411, on our November webinar, I discussed the expectations of nursing home oversight. That's what we can expect from the state agencies that are responsible for ensuring resident safety. So just a little bit of background here. The Nursing Home Reform Law was passed in 1987, and it requires that every nursing home that participates in the Medicaid and or Medicare program agrees to meet or exceed the expectations laid out in the reform law and its implementing regulations. And it is important to note that participation in these programs is voluntary. Nursing homes that do not wish to meet these federal standards are free to run private facilities and not receive this funding. So the federal law requires that every nursing home resident is provided the quality of life services sufficient to attain and maintain their highest practicable physical, emotional, and psychosocial well-being. the law emphasizes individualized patient-centered care, and it lays out specific resident rights from good care and monitoring to a quality of life that maximizes choice, dignity, and autonomy. So if the laws and the standards that have been in place for over 30 years are as strong as I was just stating, then why are nursing homes not decent and safe places to live and work? This is because the laws and standards that are in place to protect resident and workers can only make a difference if they are enforced. And that's what this entire project has been about, oversight and enforcement. As you can see on the screen, there have been many studies and reports on this issue throughout the years by LTCCC, other organizations and agencies like the OIG, GAO, different news media that indicate that these baseline tenets are largely unrealized in the lives of residents. So in 2015, LTCCC did a study that found significant failure to identify resident harm. States rarely classify violations of minimum health standards as causing harm or putting residents in immediate jeopardy. And as I mentioned earlier, the Elder Justice newsletter is a nice intro to this program because in those newsletters, we discuss nursing home deficiencies from across the country that were cited as causing no harm to residents when we believe that they should have been cited as causing harm. And if you have read any of those newsletters, then I'm sure you can understand why. But because only findings of harm result in a penalty against the nursing home, this means that penalties for substandard care are exceedingly rare. So the 2015 study by LTCCC raised concerns about regional variations in quality assurance. So if you caught the November webinar, you know that CMS contracts with states to conduct effective oversight of nursing home care. And then CMS provides the rules for state performance in the state operations manual and oversees performance through regional offices across the country. So moving into our 2021 study, we looked at what we can expect from those responsible for ensuring that residents are safe and treated with dignity, and to what extent the requirements for nursing homes and the state agencies are being realized in the lives of residents. So part one was all about the expectations. We explored the state's role in nursing home oversight, and we produced a guide that covers important sections from the state operations manual that we thought were really important for residents, family members, advocates, and others to know so that they can support their resident-centered advocacy and care. And so now I am going to hand it off to Eric Goldwein to discuss the reality of nursing home oversight using the data that we pulled from this report.
All right, thank you. And yeah, that was Haley Cronquist, our policy attorney. She forgot to introduce herself, yeah, but she's our wonderful policy attorney. I'm going to talk about the reality. So what you just heard from Haley, or at least you heard a summarized version of this, and if those who were in attendance last month learned that there's a set of rules for our oversight agencies. There's rules about survey frequency, about conflicts of interest, about what to do when a facility or a nursing home is out of compliance. And these are designed to ensure that residents are getting the care that they need. These are the expectations, but I'm going to discuss the reality, and this is based on the findings of our report, which is an assessment of state and federal enforcement agency performance. And in this report, we analyzed survey and enforcement data at the state, regional, and federal levels. Now, there will be a pop quiz here, so I hope everybody is paying attention. I guess it's not really a pop quiz anymore if I've just announced it, but take note and just be prepared to answer a couple, I promise they won't be too hard, a couple quick poll questions. So I'm going to break down my presentation into three parts. First, discussing the background of the study, then the findings, then I'm going to give a tour of the digital version of these reports and explain how you might look into this data yourself, because while we offered our own summary data and our own findings and our own information, there's a lot more data in there for you to explore. So in this study, what we did was we took a 3-year sample of nursing home survey data. These are 290,000 total citations or deficiencies. We'll use these two words interchangeably, which is roughly 100,000 citations per year. So each citation includes an F tag, which is what category of nursing home regulation was cited. Then it includes a severity code, and that is what is the level of severity A through L did the surveyors determine. Note that G or above is considered harm, and J or above is considered immediate jeopardy. And we'll go over how many of these end up being cited as harm and immediate jeopardy later, but just to offer you a sneak preview, the vast majority are not cited as harm. So our report evaluates survey data on several important categories, including antipsychotics, infection control, pressure ulcers, quality of life, resident rights, sufficient staffing. You'll see an F tag next to each of those categories on the screen. So antipsychotics is F758, pressure ulcers is F686. Now, you don't need to memorize all of that, but we just want to let you know that these things are coded in a certain way. And on the right of this page, you'll see a little, it's a screenshot of the data set that we pulled. You'll see here is about 20 or so deficiencies. Each of them have what nursing home had happened, what state, when the survey took place, what was the deficiency category and tag, and then what was the scope and severity. Now there's 290,000 of these. We did not read all 290,000 of them. However, we have read our fair share. And it's important that while this is a data focused report, it's important to remember that each of these citations has a story. They have people involved, they have staff involved, they have residents involved, they have residents' families involved. And I just want to zoom in and show you an example of one of the 290,000. So what you see here is an example of a deficiency. Again, we analyzed 290,000 of these. We did not analyze each of them in detail, but we did analyze their summary data. This is at a Michigan nursing home that failed to provide enough nursing staff every day to meet the needs of residents. This probably sounds like a familiar story for a lot of you in attendance. So what the surveyor found was that there was slow call light responses. The staffing shortages were worse at nights and weekends. And the surveyor interviewed a resident who said, for the last couple of weeks, there's only been 2 people at night. I've had a medical condition and it can be frightening. So this deficiency, it was an F725, that's sufficient nursing staff, and it was coded as E severity. And as you might recall from before, everything below G is not considered harm. So again, there's 290,000 of these, and this is a data focused report, so we're only going, our findings on this are more focused on the overall summary data, but again, these are people involved. I mentioned the scope and severity A through L, and this is a chart that can help you show what each of them means. So you'll see that A, B, C is no actual harm with potential for minimal harm. D through F is no actual harm with potential for more than minimal harm that is not immediate jeopardy. And then we get to the harms. That's G, H, and I, actual harm that is not immediate jeopardy, and J, K, L, immediate jeopardy to resident health or safety. CMS and state survey agencies use this grid to rate the seriousness of deficiencies, and they indicate a level of harm. And unfortunately, most of the violations, 95%, are cited as not causing harm. So that is A through F. So here's our quiz. We'll start with, if Haley could pull up the polls here. We have 2 questions. One, what is an F tag? Is it a game you play at recess? Is it the itchy thing on the back of your shirt? Or is it a number corresponding to a specific regulation within the Code of Federal regulations. Now, this is, I hope everybody gets this. It's looking like we're getting 100% here. Question 2 is a little harder. What is this report assessing? Is it assessing nursing home star ratings? Is it assessing state and regional enforcement of nursing homes? Or is it assessing quality of care? So we'll give you a few more seconds to complete the poll. We got 90 or so. We'll wait till we get to, all right, we'll let it go. We'll let it roll. A reminder, the title of this program is called Broken Promises, an Assessment of Oversight and Enforcement in Nursing Homes. So that might help you for the second question. Okay, I'm going to end the poll. And our answers are an F tag is a number corresponding to a specific regulation within the Code of Federal Regulations. The second question was a little trickier. About half of you got it. I should say 100% got the first answer. Half of you got the second. The report is assessing state and regional enforcement of nursing homes. Now, it's also, to an extent, assessing quality of care. So I'll be a generous teacher and I'll give everybody that chose B partial credit. Or everybody that chose C partial credit. Okay, so who are we assessing in this report? We're looking at 3 groups. One is the US states plus DC and Puerto Rico. And we should note that smaller states have fewer nursing homes and fewer residents. And so therefore, they're more prone to the limitations of small sample sizes. Consistently, we find that Alaska and DC are near the top of lists, and or I should say Alaska, not necessarily DC, and that may be due to some of the characteristics of that region and the sizes of the 10 or so nursing homes there. We are also assessing CMS regions. There are, remember this, there are 10 regional locations of the Center for Medicare and Medicaid Services that are tasked with overseeing enforcement agencies in their respective states. As you see on the map to the right, these are broken down by region. So for example, region 2 is New York, New Jersey, and Puerto Rico. Region 10 is Washington, Alaska, Oregon, and region 9 is California, Nevada. So again, different regions for different parts of the country for different regions. Now we are also assessing the federal summary data. This is how is the US performing as a whole when it comes to enforcement. And this is important, not necessarily to set a benchmark of what different states should be trying to achieve or different regions should be trying to achieve, but it is helpful in terms of I'm having a little mic trouble, so hang tight. Okay. All right, I'm going to just pause for a sec because something just happened to our subtitles. So 1 second. Okay, so hopefully we're back and the microphone is now working and the subtitles are back. So we are evaluating 2 primary metrics for enforcement performance. One of these is how many citations per resident per year. So as a rule of thumb, higher rates of citations per resident per year imply more frequent citations, which means generally stronger enforcement. As an example, in Pennsylvania, surveyors recorded 0.0 citations per resident per year, which ranked in the middle of the pack. Our second metric is citation severity. And this is what proportion of citations were cited as harm, G or above. A higher percentage of severe citation or a higher percentage of harm citations implies more severe enforcement. So just as an example, in Region 8, 2.9% of infection control deficiencies were cited as harm. Now, just you'll see in the fine print at the bottom a couple methodology notes. Our primary variables for antipsychotic citation rates and pressure ulcer citation rates were measured based on the number, not the number of total residents, but the number of residents receiving antipsychotics and the residents with unhealed pressure ulcers. The other primary variables for other enforcement categories were measured based on total resident population. Okay, quiz 2. And I'm going to have you, I'll let you take a sneak peek at, or I'll let you take a peek at the previous slide for 1 second and look at these two things. And then we'll go to quiz 2. What primary variables are we using to evaluate state, region, and federal enforcement? Is it A, nursing home star ratings, B, annual citation rates and citation severity, or is it C, none of the above? And the second, and I promise, final question of the official LTCCC Nursing Home 411 2021 pop quiz is, how many CMS regional locations are there? Is it A, 3, B, 10, C, 57.543? Okay, we'll give it a little more time. Okay, and we will close it in 3, 2, 1, and pull. Excellent. So 93% of you got the first answer correct, which is B, annual citation rates and citation severity is what we are using to evaluate enforcement in this report. And the second question, again, 93% answered that there are 10 CMS regional locations in the United States, which that is the map that we saw in the previous slide. So congratulations. That's our friend Dwight. He is proud of you. Everybody gets an A+, or 93% of you get an A+. So while many of you got A+, the grades for enforcement that we would give out would not be an A+. What we found based on the 290,000 citations is that surveyors recorded 1 citation for every 13 residents annually in the 3-year period from 2018 to 2020. So in other words, at a 130 bed facility, at a nursing home with 130 people, you would expect 10 citations in a given year at that nursing home. Now that itself doesn't seem so off, but when you consider that only 5% of these citations are considered harm and only 1.8% were categorized as immediate jeopardy, it gets a lot more worrisome. So just as an example, at a 260-person nursing home, given our data, you would expect in a given year that there would only be 1 harm citation. And at a, it would take, it's about 1 immediate jeopardy citation for every 600 plus residents. Now, most of you here know a resident, that you know residents you have seen firsthand. Many of them experience harm due to a nursing home not following standards. And maybe what happened there was cited as harm, maybe it wasn't cited as harm, but our findings suggest that the vast majority of citations are not cited as harm, and it is very rare to identify a harm deficiency. Some categories were more likely to be cited than others. One of those is infection prevention and control, F880, which accounted for roughly 8% of all deficiencies. Now, we should note that this was a 3-year study in the years 2018 to 2020. So some of this data occurred during the pandemic, starting from March 2020 to the end of the year. So there might have been different attention paid to infection prevention and control at those times versus previous times. Other categories that we examined were antipsychotics, pressure ulcers, resident rights, which each accounted for roughly 2%. Staffing accounted for 1% of all citations, of all the 290,000 citations, and quality of life accounted for 0.1%. So I will show you the report in a few minutes to show you the digital version, but the map you see on the right shows which states and regions were more and less likely to identify citations, with the darker colors and the darker colors being less likely to identify citations and the larger circles being less likely to identify harm citation. So state and regional enforcement and severity varied considerably across states, across regions, but it was pretty consistent across different categories of nursing home care. So a state that ranked in the top 10 or the bottom 10 in staffing would be likely to be in the top 10 in infection control. And this isn't a perfect correlation, but there was a lot of similarities in performance across categories. New Jersey and New York, for example, ranked in the bottom quintile in most citation metrics evaluated in this report. Just as one example, when we were assessing overall citations in New York, we found that there was 1 citation for every 50 residents. Now, if you look at Alaska, there was 1 citation for every 4 residents. And a lot of other states fell in between those 2 extremes. Region 2, which is, again, New York, New Jersey, and Puerto Rico, ranked at the bottom of most enforcement metrics, meaning that the region had lower enforcement rates and lower rates of severity than other regions. Region 10, you'll see the lighter shades in the Northwest. They tended to rank first and second in most enforcement metrics, meaning that they were more likely to identify citations. And so some more findings for New York State. Again, it was last in overall citation rate, and only 1 of the 50 citations were cited as harm, which ranks 48 of the 52 states and territories. And 1 in every 230 citations were cited as immediate jeopardy. So again, not only was New York State at the bottom of citation rate, of the citations they cited, very few were cited as harm. Now, New York State never categorized inappropriate drugging in the 3-year period as causing harm. 17% of New York residents are receiving antipsychotics. So one would think that at least one time a surveyor might identify one of those instances where it was categorized as harming the resident. And we should acknowledge that most states had very few harm antipsychotics. So that while it was 0 in New York, other states had a similar trend. New York ranked last in annual infection control and prevention citation rates with 1.6 per 1,000 residents. And these citations were categorized as harm only 1.6% of the time. And New York rarely cited nursing homes for sufficient staffing despite having rampant understaffing in the state. So there were only a total of 55 sufficient staffing citations in the 3-year period, or 0.18 citations annually for every 1,000 residents. I'm going to quickly transition to the digital version of this report, because as I mentioned before, there's a lot of information in there, and we're only giving you a few highlights or lowlights. And what we would like is for you to be able to look at this data yourselves and explore the findings. So, screen share. So this is what the report looks like. Again, it's called Broken Promises, an assessment of federal data on nursing home oversight. And here you can download the full report or just look at individual sections. So if you see the full report, you'll see a 56-page document and a table of contents with different categories and the introduction. I'm sorry if I'm making you dizzy with all this scrolling, but you'll see a whole lot of information on methodology, and then you'll get to the individual sections, which each provide information on just introductory information. It offers information on key findings, then offers information on findings at the state level and at the regional level, and then pictures of the data visualizations and tables. So you can look at California and see what their annual citation rate was. You can look at how many harm citations a state had, where they rank compared to other states. Now, that's one way to review this report. The other way is to look at individual sections. So say you were specifically interested in staffing. You would click staffing, read more, and you would just be brought straight to the staffing section, and you'd have some basic information about the importance of staffing and the data and research that exists on staffing. And then you would have information based on our report, such as our findings at the federal level, our findings at the state level, and our findings at the regional level. And again, each of these sections has a map depicting the different performances of states across the US. So here again, you'll see Washington State had more frequent citations and higher rates of citations compared to other states like New York. And you'll be able to see a table with that data. So Washington, 3.1 citations per their annual citation rate, and New York is 0.2, so 10 times as high. So back to the report. If you are here, you'll also have access to our Tableau, and this is a chance to have a more interactive experience for you to see those maps and hover over different states and see what's going on. So if you, again, some of the people are more visual in how they learn and register data. So you can go here and you can look at the overall citations. Let's see what's going on in New York. Again, at 0.02 citations per resident, with 2% being cited as harm. And you can also look at a table and you can sort it. So you can look who ranks first, who ranks last in citations per resident. And the same thing with the rank for harm citations. And you can view performance at the CMS regional level, the 10 CMS regions in the United States. So this tab is citations, but we also have information on antipsychotics, infection control, pressure ulcers, quality of life, resident rights, and staffing and fines. So I haven't discussed fines yet, but this category explores how frequently were what level of fines were levied on states or on CMS regions, how much money were they required to pay, how frequently were they fined, what was the average money per fine. And this can, again, give you a indicator of how much a state or region is being monetarily enforced in comparison to other states and other regions. So I'm going to stop sharing. I'm going to get back to the PowerPoint. Okay. So last thing on this report before we move on to questions, and also we're going to talk about the oral history project for just a few minutes, is our sources. So just so you know, we're not pulling this out of thin air. The data comes from a federal data set of health deficiencies from surveys conducted in the 3-year period from 2018 to 2020. And this, again, as I mentioned before, includes citation, location of the nursing home, the date, the survey data, the F-tag, and the scope and severity. We also used MDS frequency reports summarizing information for residents in nursing homes at the time of their report based on MDS assessment records. This was particularly helpful for antipsychotics and unhealed pressure ulcers. We were able to determine or have not necessarily a perfect number, but have a number of indicating how many residents in a state were being administered antipsychotic drugs, or how many residents in a state had unhealed pressure ulcers. And we also had used payroll-based journal data to report staffing information. So again, we'll leave a few minutes at the end for questions about that report. But I wanted to share, while we have you here, the project that we just published last week, the middle of last week, an oral history of COVID in nursing homes, which you have all lived. But this is an opportunity to better understand the life in long-term care settings during the pandemic. We spoke to residents, we spoke to family members, advocates, legislators from across the United States. Haley, myself, Casey, who is our policy intern, conducted interviews with different people to hear about what their experiences were like, whether they were living in a nursing home, whether they were navigating the hundreds of visitation barriers. And we identified several themes from these interviews, including a high rates of isolation. We heard about infantilization from residents being treated not like humans, not like adults, but like children without any autonomy. We heard about inequality, sexism, racism, classism. We heard a number of people say that the pandemic exposed problems in nursing homes that already existed. So, for example, understaffing is a problem that's plagued nursing home for decades, and this pandemic brought it to light, and it's brought attention to issues like understaffing, like antipsychotics, and helped the public become more aware. And hopefully, we can take something positive out of this, and that there is some energy behind an awareness about what is going on. Then lastly, the role of technology came up, both from the resident perspective, from family perspective, from ombudsman, where we now have more opportunities to communicate with FaceTime, with Zoom calls, and we have more opportunity to get information through technological, through devices. But this also comes with downsides, because we still need a human element. We still need human touch. So I'm going to again get back to a screen share in just a second. There's screen. So this is what the page looks like, and from here you can click on different residents and hear their interviews. You can hear sound bites, so you can listen to the whole interview. Bruce was one of our my favorite interviews that we spoke to, and this is where the quote, "I'm trapped, I'm locked down, and I feel like I'm in prison." This is from Bruce, who was 63 years old at the time of this interview. Before the pandemic, he'd go to the gym, he'd go to movies, he'd do all sorts of things. And then the pandemic happened, and as he said, he was trapped, he was locked down, and he felt like he was in prison. So I'm going to play. Let's see, what quote can we pick here? So these are different sound bites from the residents and from the interview participants. And you can click them there. They're usually anywhere from 15 to 45 seconds. So here's one just about how the pandemic impacted his ability to exercise.
In 2019, I put 1,200 miles in my wheelchair, going to concerts and movies and hanging out with my brother and going to the gym. I was actually got back into the gym 3 days a week in 2019. And then 2020, that all crashed when COVID came. I haven't been to the gym since.
So yeah, hopefully the sound went through. But you'll hear different sound clips like this, and it's a chance to learn about the people in nursing homes, learn about their families, learn about the advocates, and hear about their experiences, and attach faces and stories and a human element to all of these numbers we're hearing. And there's been, I think the latest stat going around is that 1 in every 100 US seniors has died from COVID. And I think the latest count in nursing homes is roughly 200,000, which is horrifying and terrible, but just as horrifying is the people that are still suffering through this due to COVID, due to the restrictions that were in place, due to the isolation, deteriorating mental health, and everything. So again, it's nursingHome411.org. We would love for you to check it out, share it on Twitter, share it on Facebook, and tell people about it. We think it's just a really important story. As much as I am excited about the data report that is the subject of today's program, I'm even more excited about this oral history project and its potential to let people know what is going on inside nursing homes. So back to the PowerPoint. And I'm going to hand it back to Haley.
Thank you. Oh, sorry, I was muted. You'd think I would learn that by now. It's been, a long time with Zoom, but thank you, Eric, so much for today's program. It was really informative and excellent. And so The slide on your screen right now is for our January 2022 webinar. It will be the first webinar of the year in January. It's on January 18th at 1 p.m. And if you don't already know, all of our webinars are on the third Tuesday of the month. So always be on the lookout for that. You can register at that link there. And this webinar is really just how to fully take advantage of LTCCC's resources so that you can be the best advocate for yourself or your loved one or nursing home residents in general. So be sure to sign up for that. That will be hosted again by possibly Eric, I believe, and Richard, who couldn't be here with us today, but he is our executive director. I'm sure that you all know him. He's really excellent. So that will be a great program. So please make sure to register for that, put it on your calendar, and we hope to see you there. So the next thing we will get into is the Q&A. And also, I just thank you, Eric, for the introduction earlier. I forgot to introduce myself, but again, I'm Haley Cronquist. I'm the policy attorney here at LTCCC. So thank you again for joining us today. And we will get started with the Q&A. So the first question I have for you, Eric, is from an anonymous attendee. It says, I've heard surveyors and others say that enforcement is hamstrung in certain ways by CMS survey requirements themselves. Can you speak to this? Is this true in your view? And if so, what federal reform is needed to ensure better enforcement?
I'm curious in what ways they are hamstrung. What we've heard is that different states there's different resources being put into survey and enforcement, and if you have more people there, and if it's if there's more consistency in leadership and there's more continuity, then then they will likely have better results. A way that they might be hamstrung is due to a lack of understanding of the rules, a lack of resources, a lack of the surprise element. And I say this in reference to some nursing homes. While it's supposed to be surprise visits on I believe 12 to 15 month cycle, there is sometimes where a nursing home will have some awareness that the surveyors are coming in, and then they'll start to clean up, or they'll prepare in a different way. And but yeah, as far as their hamstrung, I don't have a perfect answer for you there.
The next question we have is from Anne, and it says, at what point are citations issued? So on annual inspections or on calls from people, how does that happen? And I can actually, I will jump in on this a little bit. So surveyors, like Eric just said, are required to inspect facilities yearly. They have a 12 to 15 month window, and citations are issued upon inspections. And then there are also complaints. So if a resident has a specific complaint, they can file that, and then a surveyor might go in, assess the complaint, and issue a citation at that point as well. So it happens both ways. So the next one, this is actually just a comment from Janine. Hi, Janine. This says, nursing homes get cited, residents are harmed and die, and nothing seems to happen to the administrators and owners of these nursing homes. The nursing home lobbyists are winning, and our loved ones are suffering and slowly dying. Unfortunately, that is it's the truth. It really is. And so one thing that I mentioned at the beginning that you as advocates can do is head to our alert about the Build Back Better Act. It's a lot of B's. You can head to our alert for that and call your senators. make sure that they know that, these staffing provisions that they removed are really important and need to be put back in, because we know time and time again, all of these studies have said that staffing is such an important indicator of good quality of care. So please be sure to do that. Our next question is from Michelle. What needs to be done? Remedial training of state surveyors, change the criteria, better transparency through acknowledging formal grievances at nursing homes?
Yeah, so I think training is a positive step. Haley has spoken about the guidance for surveyors in the previous webinar, and there's a lot in there, and a lot of it's fairly clear. A lot of it can be somewhat confusing, and it would be hard to expect every surveyor to understand the 10,000 pages in every piece of every tiny detail in that thing. And there is training that exists on this, and I don't want to criticize that training because some of it is probably effective, and it's a tough tough thing to hurdle. What came to mind when I look at this data is I keep looking at the Northwest and seeing the lighter shade in Washington State, and Washington State, which has the highest or a higher level of staffing than most states, but also has a higher level of staffing, citations, and enforcement. And that tells me that there is something going on, and Washington State has its fair share of problems. If we remember, the nursing home that first was in the news because of the pandemic was in Washington State, but they seem to be having a greater attention on the need for staffing in general, and I think that's had a trickle down effect to the enforcement agencies and to the surveyors to perhaps have a greater focus on staffing when they're in a nursing home, and so that they are more likely to identify a sufficient staffing citation. There's so much data in here that we didn't explore at an individual state level. So I have some understanding about Washington State's staffing laws, but I couldn't tell you what's going on at Mississippi or New Hampshire or different states and why they are higher or lower, just that there is significant variation. And I guess one thing that can be done is the states with higher enforcement levels in some categories might have something fundamentally stronger that other states could look to, because it's the same. It, in theory, is the same federal guide that everyone should be following. But again, these state enforcement agencies are performing differently.
So a question from Chris, it says, is there a correlation between health department funding levels and their enforcement performance?
I don't know. That would seems like a reasonable hypothesis. And it would align with when we've spoken to people who are closer in this and who've worked with surveyors and who've worked with who are in the legislative side of things and who have seen what happens when there's changes in state leadership. And it would make sense to me that a higher funded health department, a health department with more funding would have stronger enforcement, but that's just a hypothesis of mine.
Yeah. So another question from Francis, actually a two-part. How are members of the survey team chosen, and has any nursing home been decertified due to the oversight process?
Okay, so Haley, can I pass? So question two, yes, nursing homes are decertified due to the oversight process. I don't have a number on how many, but yes. And how are the survey teams chosen. There are rules on survey team size. There's rules about who should be on those teams. There are rules about conflicts of interest, as in a surveyor can't be the wife of the administrator, or that would be a more egregious example. But there's different rules about how the survey team is chosen. And Haley worked on the guide that offers the rules for this. Do you have any other?
Yeah, I'll jump in. So like Eric was saying, the survey team size, it can really vary. It's dependent upon a few different factors. The size of the facility, the needs of the residents, whether the facility has a historical pattern of, serious deficiencies, whether there are special care units within the facility. But you can find more information on that in the survey process section of the guide, which again, I will put a link in the chat to that so that you can access that, but it's in the survey process section and it describes all about the survey team size and composition.
Okay, so I think we got time for one or two more. I like this question from Dennis. Do you have a sense of whether CMS evaluates this type of data for oversight of their regions? I hope they do. What our report is doing differently from previous reports is we did take the regional data, which required combining the different states, making sure that we had their resident population levels and identifying the citations per total residents. And again, as you saw in the map, there were certain areas of the country where there were different trends. For example, the Northwest seemed to have stronger enforcement. You saw the lighter shades of orange. We saw for antipsychotics, the South seemed to have higher rates of antipsychotics and lower rates of antipsychotic enforcement. And there are, I hope that they're looking specifically at this data, but there is different regional research out there, and that we're hoping that this report adds to the existing body of research on the regional performance. And let's see, do we have anything? So I think we should just take a few minutes. Again, it's the last week before the holidays, and it's our last webinar of 2021. And Haley mentioned before that we're really grateful for all your support for attending these webinars, for attending these webinars. On many of you, I suspect it's a holiday week, and you make our advocacy possible. We enjoy conducting these programs, and we just want to let you know if there are ideas or feedback that you have for us on how to make these programs better, and how to make our fact sheets, on how to make our data sets more user-friendly. We're going to put a link in the chat to our email address. That's info@ltccc.org. And we want to hear from you about ways that we can make these programs more accessible for you, for consumers, for researchers, and for families. And did we add the link to the Survey Monkey? So if your program advisor allows credit for attending this training program, you can take a quick survey at surveymonkey.com/r/LTCCC-LTCOP1. And on that note, I want to wish everybody a happy holidays and to stay safe, and we will see you in 2022.
Thanks all.